Cronkite News starts now.
Good evening and welcome to Cronkite News Refresh on Arizona PBS. I'm Serena Raboyne. Thank you for joining us. Arizona is not out of the woods yet when it comes to COVID-19 case numbers. The Department of Health Services added 9,398 new coronavirus cases to its dashboard today. The agency is also reporting 244 additional COVID-related deaths. The state has seen nearly 700,000 cases since the pandemic began and almost 12,000 deaths. President Joe Biden and Vice President Kamala Harris were sworn into office yesterday in Washington, D.C. Arizona's Republican Governor Doug Ducey attended the ceremony, tweeting that I congratulate President Biden and Vice President Harris and look forward to working with this administration to advocate for the people of Arizona. Democratic Senator Kyrsten Sinema was also there and said in a statement that while she and Biden don't agree on every issue, she pledges to find compromises instead of sowing divisions. Several other Arizona lawmakers, including Democratic Senator Mark Kelly, Republican Representative Debbie Leskow, and Democratic Representative Raul Grijalva, also made public comments about the event. But Biden and Harris weren't the only stars of yesterday's ceremony. One of the highlights, Bernie Sanders. That's right, Bernie was all over the internet yesterday when he showed up to the ceremony in this ensemble and apparently carrying his mail. People photoshopped him into everything, from Game of Thrones to even that famous skyscraper photo. He's right here if you can't see, and even on the bench next to Forrest Gump. So where did he get those cozy hand covers? It turns out a second grade teacher in Vermont sewed them for Sanders. Her name is Jen Ellis, and she makes those mittens with recycled plastic. More than 300,000 doses of COVID-19 vaccine have been given out in Arizona, according to the State Department of Health Services. But some still have questions about the safety of their shots and their manufacturers. I sat down to explain the three major vaccines and their differences. Let's take a look at comparing the three COVID-19 vaccines that are slowly becoming available to the American public. All three COVID-19 vaccines we will be discussing have been rigorously tested by the standards set by the FDA. Number 1. The Pfizer-BioNTech vaccine. This vaccine was authorized for emergency use by the FDA on December 11th. It works based off of Messenger RNA, or mRNA. An mRNA vaccine does not use the live virus that causes COVID-19, and it doesn't affect or interact with our DNA. Instead, the COVID-19 mRNA vaccine gives instructions for cells to make a harmless piece of the spike protein, or one of the bumps on the outside of the virus. Once these instructions are delivered inside of our body, our cells use them up to make the protein piece. Once the protein is made, the instructions are destroyed. It's at that point that our body realizes that this protein is unfamiliar, and our body starts making antibodies. After this whole process, the body has learned how to protect itself against the virus with those specific proteins from the instructions. This vaccine is given in the upper arm muscle, and you need to get 2 doses 3 weeks apart. A few side effects have been reported, like fatigue, headache, chills, and muscle pain, especially after the second dose. The CDC says that if you've had a severe allergic reaction to other vaccines, ask your doctor before receiving this specific vaccine. This vaccine has not been studied in pregnant women, but experts recommend if pregnant or nursing mothers want the vaccine, they should get one. Based on clinical trials, the Pfizer-BioNTech vaccine was 95% effective at preventing COVID-19. Since December 18th, there have been 50 million doses available to give to patients. It's expected that there will be 1.3 billion doses in 2021 and is recommended to those 16 years or older. Number 2, the Moderna vaccine. This vaccine was authorized for emergency use on December 18th. Just like the Pfizer vaccine, the Moderna vaccine works off of mRNA. Researchers have been working with mRNA vaccines for decades. What's appealing about these vaccines is that they can be developed with readily available laboratory materials. This allows the vaccine development process to go faster. This vaccine is given into the upper arm muscle as well, and you need 2 doses, 1 month or 28 days apart. The side effects that have been reported for this vaccine are fever, muscle aches, and headaches lasting a few days. Effects are reportedly worse after the second dose. Just like the Pfizer vaccine, the CDC says that if you've had a severe allergic reaction to other vaccines, ask your doctor before receiving this specific vaccine. There's limited data on pregnant women and nursing moms. The CDC says that pregnant women may choose to receive the vaccine. Based on clinical trials, the Moderna vaccine was 94.1% effective at preventing COVID-19. Since December 21st, there were 20 million doses available. It's expected that there will be 80 million doses for the U.S. in 2021, and it's recommended for those 18 years or older. Number 3, the Oxford AstraZeneca vaccine. This vaccine is currently in stage 3 clinical trials, which means it's been administered to thousands of people in randomized controlled studies throughout various demographic groups. Unlike the Pfizer and Moderna vaccines, the Oxford AstraZeneca vaccine uses double-stranded DNA instead of mRNA. What this vaccine is, it's a modified adenovirus, like something that would cause common cold or flu-like symptoms, with the added coronavirus spike protein. This virus can enter cells, but it can't replicate once inside of them. This vaccine is more rugged than the mRNA vaccines. The adenovirus protects the DNA inside of it. Therefore, this vaccine doesn't have to stay frozen. It can last at least 6 months while staying refrigerated at 38 to 46 degrees Fahrenheit. This vaccine requires 2 doses, given 4 weeks apart. As of right now, the first dose of the vaccine was 90% effective at preventing COVID-19 at clinical trial, but the second dose had around a 62% efficacy. Researchers believe that the first dose just did a better job at replicating the experience of an infection. The company expects to produce up to 2 billion doses in 2021, but it will not be used in the U.S. until the FDA authorizes it. This is what we know about the 3 major vaccines so far. For more information about each one, visit the CDC website. Reporting and drawing for Cronkite News, I'm Serena Raboyne. Coming up on Cronkite News, firewood is a vital heat source for the residents on the Navajo Nation. We'll take a look at what one nonprofit is doing to keep elders warm throughout the winter. And on Break It Down, the pressure of being first.
The great thing is to last and get your work done and see and hear and learn and understand. And write when there is something that you know, and not before, and not too damned much after.
Coming in April to Arizona PBS.
After more than 100 days on a ventilator due to COVID-19, a New Mexico man is recovering here in Phoenix from a double lung transplant. Faith Abercrombie has his story.
Arthur Sanchez had no major pre-existing conditions before contracting COVID-19. However, the disease led him to months spent in different hospitals and the need of an organ donor. This morning, I spoke to him and the team of medical personnel that gave Sanchez a second chance of life.
I'm so happy. Look, it can start for such a long time.
Yes, wow, really good.
For some people, COVID-19 comes with symptoms and a quarantine period.
I was one of those people that was kind of shying off the COVID thing, saying it's, nothing big, like any other virus, it's going to go away.
But for 52-year-old New Mexico resident Arthur Sanchez, the virus required a trip to Phoenix to undergo a double lung transplant.
I would probably compare it to being underwater too long and not being able to come up for air. It's a scary situation to be in. You take a breath, and typically most people will take a breath and they don't even realize because it's your body's taking care of itself.
Sanchez's life-threatening journey started back in April. After 2 hospitals in New Mexico with a continuation of inflamed and scarred lungs, doctors decided a new set of lungs was the only way for Sanchez to breathe properly.
Last resort measure of lung transplantation was used to save his life. So finally, Arthur is breathing fresh air after spending 147 days in the hospital, 116 of which were on the ventilator and over 3 months were on ECMO.
Sanchez battled the lung disease alongside many family members and refers to his transplant as a miracle.
So my sister was in the hospital, I was in the hospital, my brother-in-law was in the hospital. Unfortunately, my brother-in-law, he did not make it. He passed through complications of COVID. His heart just couldn't handle the stress that the virus put on his body. I'm a fighter and I'm a strong believer in faith. I think I'm a walking miracle.
Sanchez is cleared to return back to his family in New Mexico this weekend. Right now, he is set to have monthly check-ins for a year at Dignity Health St. Joseph's Hospital in Phoenix. In the broadcast center, Faith Abercrombie, Cronkite News.
The second attempt proved to be the right one for those who supported Proposition 207, which legalized recreational marijuana here in Arizona. It passed with 60% of the vote. Cronkite News reporter Taylor Tassler-Oatley looked into what the next steps are for businesses and consumers.
Legalizing marijuana was on the ballot in 2016. That proposition failed. This time, the movement was successful, but there are still some stops to go until anyone can buy pot without a medical card. Just because the proposition has passed doesn't mean that marijuana is immediately legal. There are a few phases to go through before the end goal is met. Chad Campbell, Senior Vice President of Strategies 360, explains once Governor Ducey makes his proclamation that the election is official,
the use of the product is no longer illegal, for personal possession at least. The home grow part is legal. But the retail operations don't really start until a little bit later on because of the licensing process that needs to be set up, the testing requirements, some of those things. That'll take a few months.
Campbell says that they created this proposition around the medical dispensaries and that Arizona voters should expect to see them to be the first ones to roll out recreational use as long as they are on good standing with the state. Raul Molina, Chief Operations Officer at the Mint Dispensary, says he does not anticipate any legal issues when transitioning to recreational use.
Whilst at the Mint, we have none. Every inspection we've had with the state has been incredible. We have a great relationship with them. The requirement from the state in order to be able to transition from medical direct or to do both is going to be that you have a license in good standing. We have a license in great standing.
Smoke Wallen, the CEO of Vertical Wellness, says from his experience in California, Arizona may face issues with local communities.
I think they have a similar provision, which is local option. So the local communities can say, I don't want a dispensary in my town or in my neighborhood.
Which Wallen says slows things down in terms of seeing stores open up. Molina mentioned that he does not anticipate a price hike with marijuana becoming recreational, but does anticipate there to be fewer deals for customers. He talks about what he's seen in Michigan, where marijuana has been legalized for about a year.
And what I've seen out here is that there's not as many specials. The prices aren't necessarily a lot higher, but you're not getting all the buy one, get one frees. You're not getting, walk in and get a joint just for free.
The passing of Prop 207 also decriminalized marijuana and will expunge felony charges for possession. A week ago, the Maricopa County Attorney's Office said they would begin dismissing all pending and unfiled charges. The office also stated, instead of continuing to spend resources on these cases, this office will begin implementing the will of the voters immediately. Arizona voters can expect to buy recreational marijuana sometime next year. In the broadcast center, Taylor Tassler-Oatley, Cronkite News.
Firewood is a vital heat source to many residents on the Navajo Nation. However, some elders and families lack the monetary or physical means to keep themselves warm throughout the winter. Delivering firewood is a serious task for the organization Chiz for Che, or CFC, because the survival of many elders on the Navajo Nation depend on it.
Chiz for Che means firewood for Grandpa. It's obvious. We don't want people to freeze. We don't want them to, pass on because they were neglected.
Lauren Anthony and his nonprofit have devoted the last 9 years doing everything in their power to bring firewood to elders at risk of death due to exposure.
We're trying to bring back the old warrior ways of life, the old, let's help our communities out, let's help our people, let's help our neighbors.
Many Navajo homes lack modern infrastructure. According to the Navajo Housing Authority, 89% of homes on the reservation are heated by wood or pellet stoves. CFC delivers over 80 free loads of firewood to elders and families in need on the Navajo Nation each year. However, the origins of the organization root from something more than just volunteering. It began as a way for Anthony and people with similar struggles to battle addiction to drugs and alcohol. Providing for the community in this way helped them make amends.
But little did I know that this would be my new addiction and also help other people in recovery as well.
Volunteers with Chiz for Che spend 3 days every week stockpiling firewood to prepare for delivery. The number of volunteers varies. Sometimes it's just Anthony. Other times, large groups come to help. But to CFC, it's the gratitude they receive for their work that keeps them going.
It is very emotional when you go and you deliver to these elders and you just see, the way that they're living and how they're forgotten. You just feel good about yourself, good about your crew, good about, what you're doing in general.
There's no price on just that feeling that you get after, this could mean somebody's life.
The organization is largely funded through donations, with GoFundMe and PayPal solicitations. But it's a shoestring operation, and even if the money and resources aren't there, they continue their work.
To be able to provide as much firewood before the next storm is always a challenge. But the thing is this is native life. This is how we roll. And when we roll this way, we also know how to be resilient, how to be resourceful.
And not even the tallest tree, the farthest stockpile, or a pandemic that has affected their people at the highest rate in the country can get in their way. Since the pandemic, CFC has extended its usual stockpiling season to ensure their goal of no cold elders is reached. To help out, you can donate to their GoFundMe found on social media.
That's it for Cronkite News tonight. Thanks for joining us. For top Arizona stories anytime, go to cronkitenews.azpbs.org.